Clinical Insight, Series 2. MRI was normal, the pain was not. Structural findings do not always explain human pain. A patient arrives with persistent neck pain. Another has shoulder pain that has lasted for months. A third struggles with chronic low back pain. Despite multiple treatments, they have already seen other doctors. They have already undergone imaging, and they often arrive with the same message: my MRI was normal. Yet they are still in pain. This situation is more common than many people realize. Modern imaging technology is incredibly powerful. MRI, ultrasound, CT scans, and X-rays allow us to visualize structures in remarkable detail. These tools are essential in modern medicine, but imaging has limitations. It can show us anatomy. It cannot always explain symptoms. A scan may reveal a disc bulge, tendon degeneration, cartilage wear, mild arthritis. Yet some patients with these findings experience little or no pain. At the same time, another patient may have severe symptoms, while imaging appears relatively unremarkable. Why? Because pain is not determined by structure alone. Human pain is influenced by multiple interacting systems. Tissue health matters, but so do inflammation, nervous system sensitivity, muscle protection patterns, movement behavior, recovery capacity, sleep quality, metabolic health, and the body's overall ability to adapt to stress. Many of these factors cannot be seen on an MRI. In musculoskeletal medicine, one of the most common mistakes is assuming that every symptom must be explained by an image. This approach can lead to two problems. First, patients may be told nothing is wrong when their imaging appears normal. Second, patients may be told their imaging abnormality is the cause of all symptoms, when it may simply be an incidental finding. Neither conclusion is always correct. A scan is one piece of information. It is not the entire story. Clinical examination remains essential. Observation, movement, assessment, palpation, functional testing, listening to the patient's history. These often provide information that imaging alone cannot. The goal is not to treat an MRI. The goal is to understand the person behind the MRI, because medicine is ultimately about patients, not pictures. At Nucellin, imaging is an important tool, but it is only one part of clinical decision-making. We believe meaningful treatment begins when imaging findings are interpreted within the context of the patient's symptoms, function, biology, and recovery capacity. Because sometimes the MRI looks normal, but the patient is not. Clinical insight. Imaging helps us understand structure. Clinical reasoning helps us understand suffering. Both are important, but they are not the same thing.